Thank you for the introduction. Hello, everyone. So I'm presenting on behalf of my colleague, Hairon Zhang. She couldn't make the conference, but I'll be presenting her work using Focused-ultrasound to deliver anti-alpha-synuclein antibody for treatment of Parkinson's disease. So just briefly, so some of the pathology of Parkinson's disease. So it's typically defined by a loss of dopaminergic neurons in the substantia nigra. And we can see that that extends into the caudate. Basically, the nigrostriatal pathway is basically degraded into the caudate putamen, which leads to some of the movement disorders we see. And so kind of the culprit that you typically see in the hallmark is Lewy bodies, which are these aggregates of abnormal protein accumulation in the brain, which is thought to cause the toxic effects leading to the neuronal death. And so passive immunization with antibodies has shown to be an efficient way to help clear out these plaques early in the disease progression to help ward off the disease. But the blood-brain barrier, of course, is a hurdle to overcome for the antibody to get into the brain, which can basically lead to the use of high doses of antibody and long treatment durations. So our goal in this study was to combine focused ultrasound and antibody to enhance the drug delivery efficiency and achieve neuroprotective effects. So on the right here is our timeline for disease progression in our mouse model, which is the A53T mouse. So you can see that abundant alpha-synuclein aggregates form typically after 8 months. And so we were hoping to do our BB opening and antibody treatment around 7 months, and we do 3 courses, and then we were looking at histology a month later, and so hoping to create a neuroprotective effect to ward off the disease. And so our methods, we were using a 1.5 megahertz focused ultrasound transducer placed above the mouse head, and we would transcranially sonicate the mouse using 450 kilopascal peak negative pulses, and the pulse duration is 6.7 milliseconds, 5 hertz PRF for 60 seconds, and we use our in-house microbubbles, which are size isolated, 4 to 5 microns in diameter, and we would inject systemically the anti-alpha-synuclein antibody at a dosage of 50 micrograms, which is approximately 10 times lower than previous studies just using systemic injection. And we would target the midbrain of the mouse. So we would do this injection, the sonication, and cavitation to create the opening, and then we would do post-FUS T1 weighted and T2 weighted MRI. So we would repeat this 3 times weekly, and then do our histology a month later. And so this was qualitatively what we would see. On the left are our MRIs. The top is the T1 weighted, showing the opening, and the red box denotes where we were looking in microscopy. And we can start T2 weighted on the bottom a week after, doesn't show any signs of damage. So what you mainly can see is comparing the control versus the BBB opening with the antibody groups. You can see the alpha-synuclein is reduced when we have the opening or just the antibody delivery alone by the decreased fluorescent intensity. And we didn't see any significant changes in the amount of neurons in the area. And so we went on to quantify this. So on the left, we quantify the alpha-synuclein based on the density on the microscopy images. So we have the control group, the BBB opening with the antibody delivery, and then the BBB opening only group. And so you can see we only see significant changes when we administer the antibody with the BBB opening. We saw a reduction in the amount of alpha-synuclein. And also if we just directly compared the left and right side, so our left was IPSI to the focused ultrasound, so it had the BBB opening, and our right side didn't. We can see that with the BBB opening, there was increased efficacy in decreasing the amount of alpha-synuclein. And then finally, we didn't see any significant changes in the amount of neurons in our region of interest. So in conclusion, so the combined treatment of focused ultrasound with the antibody was able to reduce the aggregation of alpha-synuclein in this mouse model, Parkinson's disease, without significant loss of neurons. And the antibodies alone were able to achieve a reduction, but we did see an enhancement with the BBB opening with the focused ultrasound and microbubbles. And based on the T2 weighted, we didn't see any adverse effects, which will need to be further investigated through different methods. But the future work will see if this can still have a good effect on late stage Parkinson's disease models. So we hopefully further along in the disease progression, we still can see a beneficial effect. And then finally, determine the mechanism of antibody-aided alpha-synuclein reduction. And that, I'd like to thank the Foundation for funding and NIH and our lab at Columbia University. Thanks.
Okay. Thank you. Okay, this presentation is open for questions. Well, I think my question is, this is one of several experimental methods to either bypass or open the blood-brain barrier. How does this compare quantitatively to some of things like the Trojan horse type methods that are used?
Like as far as like the opening permeability?
Well, the amount of antibody delivered.
Like versus like, I guess like a direct injection, infusion versus like just systemic.
Or things like mannitol, which have been used for years, or the Trojan horse methods where you actually
like
try
chemical
to
modification. Right. That's would be a great study. I don't know, like all the methods have been compared directly with like the same antibody. That's, you know, I guess quantified in the same manner. Yeah, that's actually something that needs to be addressed and understood. And then, you know, how much systemic injection, how much is actually improved, and how much we do actually, more we get across with the barrier opening versus just like a chemical modification or direct injection, which is invasive, but yeah, we haven't actually quantified exactly how much gets across.
I think Jürgen Götz from Queensland, I think Denali claims that with their anti-transphyretin bispecific antibodies, they get a brain uptake of 2 to 3% compared to what you normally get in the order of 0.1%.
That was with the chemical modification?
Yeah, they're basically using a bispecific antibody with a specificity of one arm for the transferrin receptor. So using a bispecific antibody.
Thank you.
It's a good discussion question. Thanks.